Open a patient chart, and you are immediately confronted with a wall of thousands of complex terms drawn from Latin and Greek. It appears to be a massive vocabulary list that must be memorized through sheer brute force. These terms function as a modular syntax for human anatomy. Each word is a composite of repeating units that specify location, severity, and physiological status. The central master formula box on this diagram identifies 3 slots used to build clinical terms. The combining form represents anatomical hardware. The prefix modifies the state of that hardware, while the suffix indicates a specific condition or procedure. We can see this mechanic in the term hepatomegaly. By separating the root, hepato, meaning liver, from the suffix, megaly, meaning enlargement, the complex word resolves into a simple description, an enlarged liver. This structural logic means that clinical fluency doesn't require memorizing a dictionary. It requires building a mental database of these 3 variables, starting with the body's physical hardware. We open the hardware database with organ roots. These act as the primary anatomical anchors, the base noun for any medical term. For the respiratory system, the primary roots are pneumo, pneumono, and pulmono, all of which map to the lungs and air. The secondary respiratory pathways use broncho for the bronchus, alveolo for the alveoli, thoraco for the chest, and pleura for the pleura lining the lungs. The red cardiac and vascular section of our reference diagram identifies cardio and corono as the roots for the heart. Below that, we differentiate the vascular plumbing, angio and vaso for vessels in general, arterio for arteries, and veno or phlebo for veins. We also log hemo and hemato for blood, and thrombo for a clot. The purple neurobox outlines the hardware of the central nervous system. This includes neuro from nerve, encephalopho for the brain, cerebro for the cerebrum, myelo for the spinal cord, meningo for the meninges, and cephalo for the head. Identifying these specific root components allows a clinician to lock down the precise anatomical coordinate of any diagnostic term. Within the abdominal cavity, the orange section details the digestive system. The primary digestive pathway uses gastro for the stomach, entero for the intestines, colo for the colon, and procto for the rectum. The accessory organs utilize hepato for the liver, chole or bilio for bile, pancreato for the pancreas, and spleno for the spleen. The renal filtration system relies on nephro or reno for the kidneys, cysto for the bladder, uretero for the ureter, and urethra for the urethra. The green MSK box catalogs the structural framework of the body, the musculoskeletal system. Here, we record osteo for bone, arthro for joint, myo for muscle, teno or tendo for tendon, and chondro for cartilage. Finally, the teal panel covers the systemic categories, including thyroido and adreno for the endocrine glands, and a specific set of roots for reproductive anatomy, ranging from gonado and ovaro to prostato and hystero. With these components loaded, our organ root database is fully populated, providing the base noun for virtually any potential medical condition. Establishing an organ root provides the noun, but clinicians require exact 3D spatial coordinates to describe locations relative to that organ. The location terms diagram plots these axes: superior or cranial for above, inferior or caudal for below. Deep is internal, superficial is surface. Anterior or ventral means front, posterior or dorsal means back. Medial points towards center, lateral points away. Proximity is established using proximal for closer to the point of attachment and distal for farther away. Lateralization is defined by ipsilateral for the same side and contralateral for the opposite. Internal location prefixes act as spatial prepositions. Intra means within, inter means between, trans means across, and endo means inner. For surface positioning, sub or infra is below, supra or epi is above, peri is around, and retro is behind. Combining an organ root with one of these spatial coordinates creates a precise map for surgical or diagnostic navigation. We move to the first slot of the master formula, the prefix. Looking at the bottom left dashboard, these components modify the intensity or state of our root noun. The yellow box shows our speed controllers, tachy for fast and brady for slow. Quantity and scale are controlled by hyper for excessive versus hypo for low, poly for many versus oligo for few, macro for large, micro for small, and pan for all. The pink box details prefixes indicating an abnormal state or absence. A or an means without, dis means abnormal or difficult, mal is bad, pseudo is false, neo is new, anti is against, and auto means self. These prefixes calibrate the exact operational state of the anatomy in question. We check the suffixes panel for the final slot of the formula, providing the specific diagnosis or clinical action. The purple conditions box lists structural indicators, itis for inflammation, osis or iasis for abnormal states, malacia for softening, sclerosis for hardening, and stenosis for narrowing. Systemic and fluid conditions are tagged with pathy for disease, emia for blood, uria for urine, raj or ragia for bursting forth, and rhea for discharge. Neurological and pain indicators use algia or dynia for pain, plegia for paralysis, and paresis for weakness. Cellular and growth conditions are logged with cytosis for increased cells, penia for deficiency, trophy for growth, plasia for formation, poesis for production, lysis for breakdown, and megaly for enlargement. When we shift from pathologies to active clinical interventions, we look at the blue procedures box. Surgical actions employ actomy for removal, atomy for an incision into, ostomy for creating a new opening, plasty for surgical repair, and desis for binding or fusion. Diagnostic actions and specialist identifiers use scopy to visualize, gram for a recorded image, graphy for an imaging process, centesis for a puncture, site for cell, blast for immature cell, clast for breakdown, and ologist for specialist. The suffix is the ultimate clinical conclusion. It completes the dataset required to decode the language. With our database of components built, we can introduce the decryption algorithm clinicians use to read this terminology rapidly. The top center of our guide details the gold rule. To parse a complex medical word efficiently, you must reverse your natural reading direction. Step 1. Jump to the end of the word to find the suffix. This tells you the pathology or the procedure. Step 2. Move left to find the organ root. This establishes the anatomical location. Step 3. Check the beginning of the word for a prefix to determine the severity or amount. We can apply the gold rule to the common terms in the ultra-high yield section, starting with cardiomyopathy. Reading in reverse, we isolate pathy, meaning disease. We link it to the secondary root myo, meaning muscle, and we locate it at the primary root cardio, the heart muscle disease. We run the same sequence all surgical procedure, like pneumonectomy. We identify the suffix ectomy, meaning surgical removal, and trace it back to the root pneumon, the lung, surgical removal of a lung. We can push the system to its limits by deconstructing an advanced diagnostic phrase, retroperitoneal hemorrhage. Decoding suffix first, we find rage, meaning bleeding. We locate it at the peritone, the peritoneum, and we check the prefix retro, establishing that the bleeding is located behind that membrane. Medical terminology is a highly structural syntax. By identifying these three variables, even the most intimidating clinical phrases resolve into a predictable structural logic.